I just want to show you, this is one of the 4 things, apart from the report, that I brought with me from the hospital. This is only on loan, together with the 2 walking frames that I had, and a single crutch. It wasn't a crutch, it was like a walking stick, and it was not a tripod or a quad pod, it was just a single pod, which in my opinion, for someone who's dizzy, and I had my stuff for dizziness, is not enough. I think you need at least a tripod or a quad pod, or unless you fall backwards a lot, a walking frame is good. I used to walk with the walking frames in the hospital all the time. Sometimes I lifted them quite high, so I walked without the frame, but I always had the frame. And this is a shower seat, but I don't use it for a shower. I use this one just after my shower, and I sit down to dry myself, which is actually quite nice. I never used to do that, but I think I will keep doing it. It's much better than drying yourself standing up. Hi guys, I'm in our bathroom, and that is fairly newly done. That was done just a short while just before I ended up in hospital. You can see the lights are not new, but the grey tiles are. And what I want to do today is I want to maybe I won't do it today, but I might do it tomorrow. I read the discharge report, but that's I think that's the report from the first hospital where I was. So it's a bit older, and I was a bit less capable than when I was actually discharged. And I've got 1, 2, 3, 4, 5 pages here of stuff. And I thought I will tell you a few things of where I was, because in Barnstable, which is the second hospital, the first one was Derriford, but with the North Devon District Hospital, I was in stroke medicine. I think that is because I had 2 brain bleeds after what happened to me. The clinical details reason for admission on this one says repatriation from Derriford Hospital. I had a skull fracture with traumatic SAH and SDH after. Undisplaced right and left rib, adnexal mass on trauma CT. That just showed that I had something on my uterus, which I knew anyway. And then it says episode of 2 to 1 second degree HB. I'm not actually totally sure what those things mean, the short things. And it says final diagnosis, traumatic SAH, falling unwitnessed fall from horse on the 30th of the 3rd, 22, cause of fall unknown. I think what they didn't understand was that the horse actually fell with me, and the horse had actually injuries as well, so that showed that she fell with me. And then I had an episode of 2nd degree heart block in ICU in Derriford, but that spontaneously resolved. And I don't know what the pneumococcus cap means, but they gave me antibiotics, I think, but I don't know why and what for, because before I had the fall, there was nothing wrong with me, with a bacterial infection or anything. And then it says I had hairline jaw fracture on CT images, and apparently I had a jaw fracture up there and down there as well. And actually, down here that still hurts a bit, but I think that is because my gums are swollen. If I touch it, I do have tooth problems now anyway. It's not great, and I have tooth problems up there as well, but I think that toothache can be from the fracture. So I'll have to wait until that is healed. I'll just turn that one off in case you've had enough of hearing from me. The next thing is I'm going to read to you this here, what my fingers are, and that is from the Peninsula Trauma Centre in Derriford Hospital in Plymouth, and that was, I think, when they sent me to Barnstable. And it's a rehabilitation prescription, it says up there. And it says here, mechanism of injury is the unwitnessed fall from a horse. Again, like I said, I think the horse fell with me because she had all the injuries to show that she was scraping on the road with her right side. And my injuries also, it's my right bone here, my right shoulder is screwed. I had a fractured right rib. I had a fracture, the fracture that they mentioned, right, that they're mentioning here, subarachnoid haemorrhage in the left frontal region, which is here, that was here. Then they say right-sided fifth rib fractured in 2 places, that was here. And then it says a large scalp hematoma over the right frontal parietal region associated with a hairline fracture extending from the right parietal bone involving the mastoid process and the right temporomandibular joint. So it was here and it went all the way back there. And even when I was discharged from hospital, I could still feel, and I think I can still feel, if you touch yourself here too deeply, a lot of people will feel discomfort because you get tightness in the muscles that hold your neck up. But mine actually went all the way up to above the ear to here. And that is better now, so I think that fracture is healing. However, what I had quite a lot in the hospital was I could feel tingling around the corner of my mouth, which is from obviously the nerves being, and my tongue, I should say, the right side of my tongue all the way back to the throat. It's like not quite right. It feels really strange. It's not quite a tingling, it's not quite a numbness, but it's something in between. I don't know how to explain it. And that is from the nerve that supplies that. If it goes around there, and it's if it's let's say broken and displaced, it would squeeze on it. Or if it's healing and you got a little bit of callus formation, that could press on it as well. The feeling in the corner of my mouth, I think, is over 90% better now. I had still quite a bit in the hospital. I have very little now. Sometimes it's a bit worse than others, but it's kind of from here to here. And the tongue is still, I would say, maybe 5%, not normal, and it's this side and going all the way back. Again, also from that fracture here, I can't remember how it was when it happened, because the first 2 weeks I cannot remember, even though people communicated with me. Mike came to visit me a couple of times. I spoke to my sister on, she brought an iPad for me. I do remember when I was in Derriford that at some point I spoke to my bird. I vaguely remember that, and that was confirmed when I said to my sister, did I speak to my bird when I was in the hospital? She said yes, I did, and I vaguely remember that, but I do not remember much at all of the first 2 weeks. Hardly anything, and people talk to me and I talk back. I spoke apparently German with my sister from Germany, but I spoke English with everyone else. I don't remember any of that. The only thing that I at the moment can say I really remember is that I spoke to my bird on the iPad. And that's really strange, I think, because the people I didn't remember. So I'll just turn that off, so you can stop watching now if you're not interested in what I have to say. And then I'll carry on reading more of it. They've named on this paper here, they've named the consultants. And it seems that I had an orthopedic consultant, and he was for my fractured rib. But what I have to say is, when I woke up, and that's a different story, that's a really weird story. When I woke up, my left foot was huge, and my left leg wasn't really swollen. It kind of stayed pretty much to the foot and to the ankle. And I started treating it myself in the hospital just to get rid of the swelling. But I do have a problem that no one, with my left ankle, that no one in the hospital ever addressed or maybe even recognized. All I can say is, when I woke up, or I should say when I became conscious, the moment that I can remember again, the first 2 weeks, even though I seemed maybe conscious, I cannot remember a dicky bird, apart from that somewhere in my head I vaguely remember that I spoke to my bird. And when I said that at home, I also noticed what I will say is the 2 horses were with me, the dog was with me when all this happened, the bird wasn't. So the bird has no idea what happened. The other 3 animals all do. And the dog was actually quite scared of me when he saw me again. And I'm absolutely 100% convinced that he thought I was dead. He had big eyes and his ears were back the first 2 days I was with him. He didn't growl at me or anything. He was kind of friendly, but I could see he was a bit scared. And I don't know what dogs think, what happens when you're dead, but he thought I was dead. The horses also thought that I had died. I could see that the first time I ever saw them. From the distance, they recognized me. They turned towards me when they heard me. They pricked their ears. They looked at me. They smelled me. I didn't think I smelled right, because the first time I saw them, I had just come from the hospital. I think they thought it was me, And then I maybe didn't smell quite like me, but they were a bit not really totally comfortable with me. That only came over the next few days when I went to visit them, because they were with a neighbour, because Mike couldn't look after them himself. He didn't know how to look after the horses, so they had to be looked after by someone else. Let me just see. I just want to read the injuries that they said I had. There was one subarachnoid haemorrhage in the left frontal region, so that's here. Then I had the right-sided fifth rib fracture in 2 places, usually ribs fracture in 2 places. That's normal because of the shape they are and because of what happens when you fall on them. And then I had a large scalp hematoma over the right frontoparietal region associated with a hairline fracture extending from the right parietal bone, involving the mastoid process on the right and the temporomandibular joint. So my joint here apparently was also involved in the fracture, and they have a little body here, and I marked a few things here, but I think that was that were my problems. But then you see, no one marked my foot, my left foot, and that left foot was a huge problem. My left foot was really big and is still giving me pain, and sometimes it slips and the pain is excruciating. I cannot put any weight on it then, and then 5 minutes later it's normal and I can walk on it. So what I think now, in the beginning I thought it was something was broken in it, but what I think now is that my talus for some reason slips, and when it's slightly dislocated I can't weight bear with that leg. And then I have to wait until it moves back in its proper place, and I can walk pretty normal in a small range. My range of my left foot, I think partly because of the residual swelling, is actually quite significantly smaller than in the right leg. So I'm going to tell you a few more things in a moment. Here is the rehabilitation prescription on this page. Now, the rehabilitation complexity scale, trauma, they are saying 1 is basic investigation, monitoring and treatment. Number 2 is specialist medical or psychiatric intervention for diagnosis or management and procedures. Number 3 is potentially unstable medical or psychiatric condition. Number 4, and this is what I am, is post-acute general medical or surgical problem. And then there's point 5 and 6 as well, which are more severe than mine, but they classed mine as a 4 on the scale to 6. And they said that my care needs, 0 is independent, 1 is help from 1 person, 2 is help from 2 people. So they were saying, when I was discharged from Derriford, that I needed help from 2 people. Then it's help from 3 people or one-to-one supervision. And then they said that there was no risk presented. So I need help from 2 people with no risk. I don't know how that works out. The nursing needs, 0 is no needs, 1 is qualified nursing, 2 is trained habilitation nurse and or mental health nurse. Maybe I was very abusive to them and they thought, oh, that's her mental health, we need to give her mental health nurse. 3 is specialist nursing care and 4 is high dependency specialist nursing. But I had a 2 trained rehabilitation nurse and or mental health nurse. Then the therapy needs, 0 is no needs, 1 is 1 discipline, 2 is 2 to 3 disciplines, 3 is 4 to 5 disciplines, and 4 is more than 6 disciplines. I have 4 to 5 disciplines, but I don't know what they mean. I think that they probably meant a physio, an occupational therapist, maybe the clinical psychologist or whatever, and then the speech therapist and the dietitian or something like that. I think that's 5 or whatever. And I'm telling you now, I don't know what happened in the first 2 weeks because I cannot remember, apart from that I spoke to my bird on the iPad, and I only vaguely remember that. I have a fairly big memory of that. I do not remember anything of the first 2 weeks. I only remember when I came to Barnstable. And that's a story in itself as well, how I woke up. And they say what equipment I needed, and it says I needed basic special equipment, whatever that was, I don't know. And then the therapy intensity, 0 is no therapy intervention, and then it goes up to 1, 2, 3 and 4, and my therapy intervention was very intensive. So I have to say that I don't know what they did in the first 10 days or so while I was in Derriford, but when I was in Barnstable, I know I went to see the physio twice. I had a session with the psychologist, and I think in the 2 weeks I had 4 sessions with people, so it wasn't like it was very intensive and I had something every day. And also, if I didn't want to go out, we were not allowed to go outside anyway because of COVID, and they didn't really encourage us to leave the room either. And I think I left my room, apart from when I had therapy or whatever, I think I left my room maybe twice in 2 weeks. And I think that's not really enough, and I don't think it's very conducive to good rehabilitation. I'm saying that as a physio as well as a patient, or as well as a patient. Yeah, I don't know why people get so little, but I have the feeling some of it had to do with staffing levels, because if they tested positive for COVID, obviously they couldn't come to work, and I'm not sure how much, well, but on our ward, there was actually only once I realised that they emptied the room and cleaned it out because one of the patients was COVID positive. No one in our room got anything. They sometimes came around and tested us for COVID. I remember being tested twice. I don't know how often they tested us in the other hospital, but in Barnstable I was tested twice. So, well, we'll see. I want to read the report to you as well, the whole thing that they wrote. But I don't know whether I'll do that now or tomorrow.